I'm Simone Olson, co-founder of Amazing Kids. Amazing Kids is a virtual autism diagnostic clinic serving families across Florida. We believe children deserve access to comprehensive, evidence-based autism evaluations in less than 72 hours. At Amazing Kids, we believe a diagnosis is not the endpoint, it is the beginning of a plan. Our mission is to empower parents with teamwork so children can grow towards independence and confidence. A critical part of that journey is understanding how to access the right therapies at the right time and how those services work together. Today's conversation is about applied behavior analysis, access to care, and how families can better navigate and connect to the supports their child needs. Today, we are honored to welcome a panel of professionals who represent both the clinical and operational sides of ABA care, as well as the real-world connection points families rely on every day. Joining us today, we have Dylan McComb, an RBT and referral and outreach specialist at Virtus Health. Welcome.
Hi.
Leah Adams, a lead BCBA at Virtus Health in Pensacola. Hi, Leah.
Hi.
Tori is a lead RBT and community engagement specialist at ABA Path. Hi,
Hello.
Tori. And Bridget LaFrance is Chief of Operations Growth and Strategy at ABA Path. Welcome, Bridget.
Thank you.
Each of our panelists brings a unique perspective to this conversation. Dylan works closely with providers across Florida to help build strong referral networks and improve access to care. Leah provides clinical leadership and helps guide individual therapy plans as a BCBA. Tori works directly with children and families while also connecting them to community resources. And Bridget leads operations, growth, and strategy and has played a key role in expanding access to services in underserved areas. Together, this panel gives us a full picture of what ABA care looks like on the ground and how systems are built to support families more effectively. Thank you for all of you for being here today. Dr. Hensley, please get us started.
Morning, everybody. So good to see you all. So I'm Dr. Jennifer Hensley, pediatric nurse practitioner and founder of Amazing Kids Autism. We have great news. We're open in Virginia and Florida. So now we've expanded north up to Virginia, which is very exciting. The whole goal for children and people with autism is to help them to assimilate and get out into society, into the community, and do all the amazing things that everybody else out there is doing that they want to do. And so we've been really fortunate these past 2 weekends to be a part of the Waves of Acceptance Festival by the Autism Coalition of Brevard and the Eat My Crust 5K at Pizza Charities that Mr. Delicious put on. And there's really nothing like being out there in the community and seeing people and children with disabilities just having fun and doing the things that they want to do. And so today we're going to meet with these wonderful panelists that are on the forefront of helping children to get out there and assimilate and do the things that they need to do to be successful. So we're going to talk about ABA, which is Applied Behavioral Analysis. It's not a single program, but it really is a scientific framework. And over the past 50 years, it's evolved from highly structure based to a lot more naturalistic, play based, which is why everybody on this panel is smiling today because they play all day long with kids. It's family centered, and really understanding the history really can kind of help us understand the strengths and the ongoing need to refine how we support people with autism and promote dignity, independence, and authentic development. So ABA is one of the most widely recognized and researched intervention approaches for children with autism. And at its core, ABA is the science of learning and behavior. It's pretty simple, right? Science of learning and behavior. It's based on principles of we take these behaviors that are influenced about and what happens before them and what happens after them. So it's kind of like an operant conditioning model. And ABA really focuses on measurable goals, systematic instruction, and ongoing data collection to really guide individualized treatment decisions. So believe it or not, I used to do the Lovaas method. So 50 years ago, ABA really started with B.F. Skinner and transformed into Dr. Ivar Lovaas. And so I was in college, I worked with children with autism. It's definitely gone leaps and bounds from them and evolved tremendously. So that's really what we're going to talk about today is modern ABA-informed approaches that really focus on child-led learning, the natural environment, play-based engagement, parent coaching involvement, and that social emotional reciprocity. So with that, I'm going to transition and talk to our wonderful speakers today. So thank you everybody for joining us. We have two wonderful ABA companies here, Virtus Health and ABA Path. And so I would like to start, and we don't usually have a rhyme or reason of who begins. If there's a question that calls you, go for it. If we want to kind of go through and everybody touch on each question, I'm fine with that as well. But can we start with just how you came into the field of ABA? Actually, I'm going to start with Leah. I changed my mind because Leah already started sharing with us why she came into ABA, and I think you'll kick it off nicely. What brought you into this field of ABA, Leah?
So 9 years ago, I had no idea what ABA was. I have the pleasure of being one of my nephew's primary caregivers, and he's now 11. But 9 years ago, we were in the process of getting him diagnosed for autism, and his occupational therapist at the time, like obviously, just like talking. I was like, "Yeah, I'm in my master's for education right now," and she's like, I think I have something that would be better for you. Like, I think I know what your niche in life is. Just like she'd seen like how I interact with my nephew. She's like, I want you to go shadow one of my friends at an ABA clinic. And I'm like, what's that? Like, completely confused. I went and shadowed and completely changed my master's program and my career path. And I fell in love with the field and saw what it can and does do for kids on the spectrum. And it's become my life and I absolutely love it.
Wonderful. Thank you for sharing. Anybody else want to answer that question?
I kind of came into it by accident. I didn't really know much about autism when I started about 4 years ago, but I just knew I wanted to learn more about mental health and knew like I had a little bit of background working with kids while I was in school to get my education degree. And so, yeah, I just applied for a job at ABA. I was like, I'm not sure what that is, but we're gonna see what happens. And then literally my first day there, I was like, oh, I love this. Like seeing the kids grow and I mean, you're playing, but also teaching them all day. Like they're like seeing them advance their skills. It's just really something to admire.
Excellent. Thank you.
I'd like to piggyback off of Dylan and Leah. I have a very similar experience roughly 6-ish years ago. I also did not know about ABA or really anything about autism, but I mostly was focused on volleyball in college. So the school part, I was like, I'll figure that out later. But I majored in psychology. In my senior year, I took a behavior modification class, and it taught me a lot about the ABA principles. And that same year, I actually met a girl who worked at an ABA company, and she started telling me about it. And I honestly was a little skeptical at first because the story she was telling me, I was like, oh, I've never worked with any group of people like that or any employees like this. So, I mean, I'll try it just because I wanted to do something new and the class was interesting. And I remember interviewing the first day, and similar to Dylan, I loved it. And it was so rewarding just seeing how in such short amount of time the kids would gravitate towards you, become so comfortable with you, and just working with them is really just overall a great experience.
So fabulous working with people with autism, isn't it? I can just see the smiles and the love in your hearts. Bridget, do you want to share your
Yeah,
path?
so actually similar to Tori, I actually didn't know anything about ABA years ago. I was in the mental health field, but in college I took a behavior modification class. And ironically, my oldest, who is now 24, was diagnosed with ADHD, and I had no idea what it was about. So I said, well, let's take this class, see what we could do. And I wrote, my project was to write a behavior plan, and I wrote it on him. And I was like, oh my gosh, this is magic. So, that was my first experience with ABA. I originally went to school to go into the field of social work. And then years later, I started work for a nonprofit. So I worked with individuals with developmental disabilities and mental health needs, primarily, older population. So young adults was a big population. Also worked with individuals with traumatic brain injuries. And then I decided to take a position in the office. It was a new position. It was for an intake and resource specialist. So it was between the billing or the client accounts and the intake. And so I had the unique opportunity to be able to really know what the individuals needed because I worked with them directly as a direct support professional, but also I knew what the administrative side needed.
After that, I moved to Florida, and that's how I found ABA Path and learned more about ABA. And then ABA became my passion, and I learned more about it. And there were so many things that I didn't know about it. I also had the opportunity to work as a contractor in the past years for ABA organizations and mental health companies across different states, which really gave me a unique perspective on how different providers operate, everything from smaller to more individualized settings to large organizations with more structured systems. So I've really seen both sides, what care looks like on the ground and what it takes for families to actually access and sustain those services. And I'm also a mother of my younger son has high functioning autism too. So
You've got two amazing kids. Is that what I'm
Mhm.
hearing?
Yes, they
Okay.
are absolutely amazing.
So tell us something amazing about them. So I know, Leah, you said you have your nephew. I just love this question asking families,
Oh
but
my gosh.
tell
So
us what's amazing about each of them.
my oldest is, I have to say, he's like a genius. He literally he can pick up anything and learn it. I mean, he has a gift for music, most importantly. When he was like 10, my mom gave him like a little Yamaha keyboard, and I came home from work, one day, and I was like, is that Moonlight Sonata playing upstairs? And I go in his room and there's no sheet music. And I was like, what, where did you learn to play that? He goes, at school today. And I was like, what? So we took
Wow.
that up. And so he's now got two pianos in the room and he plays beautifully. He writes his own music. I mean, it is just anything he puts his mind to, he can do anything. And with perfection, I mean, it's amazing. My youngest is just, I had to say, he is so gentle and caring and patient. He's really a people person. He may not be able to fully express it, but when I say patience, I mean, he's got he's just great with kids and being able to guide them. And, he just has a very great way of expressing how much he cares in other ways for people. And he loves politics. I told him, I said, you're going to be the next politician. I'm telling you. So I don't know where he got it from because I do not like anything to do with politics. So
I love that. Such gifts. Just teaching kids to be common, right? Just assimilating,
yeah,
right? They have these gifts and these talents, but we got to, help them, give them those
yeah.
tools so that they can go out there and show the world what they're capable of, right? How
Yeah, he
wonderful.
went and donated to the Charlie Kirk Foundation. I don't even know how he figured out how to do that.
Wow. How old
Yeah,
is he?
he'll be 15 in June.
That's impressive.
Yeah, he
Nice.
comes home, he was like, Mom, look at this. Did you read this letter in the mail? And I was like, what's this? I don't know what this is. And I'm reading it, and he said, you did this? So we put it on the fridge. I was like, I'm so proud
Oh
of
my
you.
goodness. Did he donate his own money too?
$4. Yep.
Wow.
Mhm.
$4. Beautiful. That's
Mhm.
beautiful. Thank you for sharing. Leah, do you
Yeah.
mind sharing something about your amazing kiddo with autism?
Yes. My nephew is he's one of those kiddos that if he puts his mind to it, he's gonna figure it out. Like watching him like just learn how to like just navigate different things. We recently got a new lawnmower, and well, did he quickly learn how to get on it and turn it on? Yes, which is not the most ideal thing, but it's always fun to like sit back and just watch him and watch his little mind like go into overdrive figuring out things because he doesn't communicate a lot. Like he's very limited on his vocal language. But if he sets his mind to it, he's gonna figure it out. Like in math too. Found out the other day from his teacher that he knows how to do division, and I was like, oh, okay. Like I'm so proud of you, but like, where did you learn that? Because like you're only like that's not even been taught to you in your classroom yet. But okay, bud.
Oh, that's amazing. That's amazing. So many gifts. I always tell my patients, if my brain could do a fraction of what your brain could do, oh, I'd be setting the world on fire. You have so many gifts. So that's great. Thank you for sharing. So, Dylan, from your vantage point, what's most important for families to understand about ABA early on?
I think early on, it's just like once they're like talking with us about getting ABA services, it's more teaching them like what ABA is and what versus what it used to be. And like ABA has changed a lot recently, and I think it's important that we're transparent with families and show them, how our services or how just ABA services are supposed to be now. and how inclusive they are with kids and how child-led they are.
Excellent. Can you expand just a little bit more on, I know we're going to talk shortly about the changes, but who dictates the changes? Like what is the board that makes the decisions and kind of, I know there's a lot of variability from ABA companies, but who does everybody follow basically?
The BACB,
Okay.
like overall entity that ABA is kind of that answers to, I guess.
Okay.
Yeah.
Perfect. 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 And so, Tori, what are your thoughts on
I'll have
ABA?
to agree with Dylan. I definitely think educating families and letting them know the process of how our company works or different companies may work, and also letting them know it's a team effort. And of course, we're going to do everything we can to increase those desirable behaviors, decrease those challenging behaviors, but also getting them aware that they also should be helping out at home in the community if we're not able to be with them in the community, and just understanding that it's not going to be a overnight resolution, I guess. It's going to be a process that everyone needs to be involved in.
Do you feel families like take to that well? Like they understand that it is therapy and that it is going to take time? I mean, what's a typical timeline that you tell families that they're going to start to see improvements in the child's behavior? I know it's going to be variable, but what do you
Yeah,
tell
I
the
was
families?
gonna say it's very hard to say just because every child is so different and we can't really determine a set date that they would meet their targets or progress to transition to new programs or new targets. So it's really hard to say.
To go off of that, like it is kind of what you said too, with a lot of it depends on how much parents are putting in at home too. Like it is a team effort. We can do so much in clinics, but to really see that change and that growth, it requires therapy kind of being given from all aspects of a kid's life to really generalize the
Mhm.
behaviors that we're trying to modify.
Excellent. And do you find most families are good about doing their homework at home?
Yeah, so a lot
Yeah.
are. Yeah, and we work with the families that might need a little bit more assistance. And our BCBAs are great about communicating with families, helping them out however we can to try to make it easy for them to do stuff at home and in community and in school as well. So we try to work with teachers and everybody to make sure that therapy is seamless across settings.
Excellent. Leah and Bridget, either one of you want to take that question? What's the most important for families to understand about ABA early on?
I think it's very important for families to understand, with ABA specifically, that we're not trying to take away their autism diagnosis. We are simply trying to improve their child's life through teaching those like desired and replacement behaviors and decreasing the challenging behaviors. Because I think there's a lot of misconceptions out there that ABA like takes away autism, and that's, I know, as I do all of our clinic tours of like potential families, and that's one of the like leading questions I get asked. I'm like, no, your child gets to be a child first at our clinic, and we're looking at individual behaviors, not necessarily their overall diagnosis. Like that's kind of like their ticket in the door for insurance reasons, but we're looking at them as a child and figuring out what we can do to improve their life overall and get them as close to like age appropriate skills as possible.
Excellent. And Bridget, what are your thoughts on that?
Yeah, so I'll answer this both from a professional and personal perspective. So I'm typically the first point of contact when families reach out. And while I'm not in a direct clinical role, I work very closely alongside the clinical teams. And as I mentioned, I'm also a parent of a child with autism. So I really cannot stress enough the importance of early intervention. That's one of the biggest factors. I'll be honest, I waited to get my son a diagnosis. So, however, not because I was skeptical, but more because we didn't have access to the funding. So, looking back, that delay makes a big difference. It doesn't necessarily get easier over time, it often gets harder because expectations increase, the gaps become more noticeable, they're going through different changes as they grow, the brain, the body. So that's like one of the biggest pieces I can say is early intervention. And then there's also a lot of stigma against getting a child a diagnosis. So a lot of families that reach out don't even know what ABA is, right? Or their doctor may have just referred them, hey, you need ABA therapy. They have no idea the commitment that it takes to have successful therapy and outcomes. Some of them don't even have a diagnosis yet, and they're just like, I need help. And so there's a lot of parents that worry about labeling. They worry that getting a diagnosis means that, their child is going to walk around with this label for the rest of their lives, and it's going to hinder them from being successful. And that's not true. So I think, I had a call the other day with a parent. It was like 45 minutes, and it was a 3-year-old, and the child is nonverbal, and the mom, they don't have a diagnosis yet, and the mom's like very hesitant to get the child. And there's some controversy about getting a child diagnosed, before the age of 5, and some doctors, won't do it. But so she was very hesitant. She says, well, what if they diagnose him with other things that he doesn't have? And I said, you're entitled to a second opinion. You can always get a second opinion. So there's that fear of the parents going out and getting that diagnosis. Like, what is that going to prevent my child from not being able to do or participate in the future? So that's really a lot of the conversations that I have, but also explaining, what does ABA look like and what does a commitment look like, even as you guys were touching on caregiver training, right? And participation, and also having services across different settings as well. So that's definitely, a big thing I suggest to be mindful of. And just, the parents are their child's best advocates. So really making sure that they understand, what is ABA? What is a comprehensive diagnostic evaluation? That's what they need to get started, right? What is that? What does that mean? So asking questions and asking their providers, and, not just other families, but, directly from the source, getting their information.
Thank you for sharing your personal feelings and experiences as well. So getting that diagnosis, as you said, is just so critical. We've got to get these kids, the earlier we can get them to interventions, the better that they're going to do, which is really why we started Amazing Kids. So we do virtual autism evaluations, so the kid is in the comfort of their own home within 72 hours. Nobody does that across the country, across the world, right? We had somebody remote in here a few weeks ago from England, and she's been waiting 3 years for an evaluation. So nationwide, it's 6 months to 36 months, but then we don't even think about that parent fear that prevents them from even taking that first step of getting the child evaluated. So when you add that onto the 6 to 36 months of the wait list, and it's probably more like 12 to 36 months of the wait list, these kids are just in dire need of intervention, right? And so that education and taking that 45 minutes for that phone call to educate this family, we as healthcare providers know that families hear 10% of what we say, which is so sad because we all talk so much. But that 45 minutes gives that time to marinate for that family and to really hopefully step up. We can diagnose as young as 1. Ideally, I love to diagnose between 2 to 4. If I can get a kid in that zone diagnosed, then I know by the time we're hitting kindergarten, 6, 7, 8, that we've got all the tools. If we diagnose later, which we can do, definitely can do, and there's lots of teenagers and adults out there that don't have diagnosis, they just develop a lot of habits that can make that change in behavior a bigger struggle. So thank you again for sharing your personal thoughts, and then also just talking about that time where parents just are fearful and in denial. And then once they get the diagnosis, I always tell my families too, like, you have more of a grieving process here. Like, now that sometimes the families fight hard to get the diagnosis and they're waiting years. And so it's just a wave of emotion. And so I always tell my families too that you have to go through this grieving process once you get the diagnosis. And it's same as any other grieving process. You have to get to acceptance. If you stay in denial or you stay in anger, you're not going to get to acceptance, and you're not going to be the best advocate for your child. And you need to advocate until your child takes the reins and puts on their own coach's hat. So thank you for sharing that. That's so important to talk about. We're going to transition over to, what does ABA therapy look like in practice? So we'll start with you, Leah, as a BCBA. How would you define high quality ABA therapy today, and how has it evolved in recent years?
I will just say that I feel like ABA has drastically evolved just from my almost 9 years of being in the field. When I started off as a RBT, Actually, I was just a behavior tech because the state that I was in did not require the RBT licensure. Um, it was heavy focused on mass trials of like DTT, like being at the table and, just doing those mass trials because all the studies out there say, hey, kids learn best by mass trialing. Like, which in reality kind of leads more to rote memorization than actually learning a skill to like being able to generalize it across all environments. And now ABA is more focused on like natural environment teaching kids through like the ways that they learn best. The other day, like I explained to a tech, I was like, hey, it's okay that we're under the table on the floor doing their like matching stuff. But I was like, they're working. I was like, meet the kid where the kid's at for the day. Like, yes, ideally, like, do we want our kids sitting at a table? Like, yes, because like this kid's getting ready to go into kindergarten, but I'm like, they're still a kid. Like, you have to meet them where they're at versus trying to like fit them in a box because you can't be in a box in the land of ABA, especially with autism. So,
Thank you. Dylan or Tori, do you want to jump in? What is
Yeah,
high quality ABA and how it has evolved?
I think that's the fun of ABA is that the field is constantly growing and we're constantly learning more and there's more research being done all the time. So whenever we learn new information, we have new ways to help our kids and advocate for our kids. And just like Leah's saying, like we, 10 years ago, that may not have been what ABA was. We may not have been working with the kid under the table, like meeting them where they're at. But now we're like, we can do that. And then we can, shape behaviors or get them to where we want them to be and make it fun for them. Like learning should be fun, and ABA can be too.
Tell me about that getting under the table. I love that. I have in my office when I was in the office, now we're all virtual, but kids are under the table. Hey, I'm going to examine you under the
Mhm.
table. We're going to
Yeah.
meet you where you are. Tell me about that. Isn't I don't know, it just brings out the kid in you a little bit, right?
I do
oh yeah,
about, when I'm working with the kids, I'm doing about 3 laps more than three. I'm running with the kids a lot. Like, I like working with the kids that are active. I'm running with them, even though I don't do cardio. We do it for the kids. If that's
Yeah.
how they learn, that's what they want to do, and that's their reinforcement. Let's get up and do it. Like, I feel like whenever they're having fun and whenever you're having fun as an RBT and a BCBA, like they're gonna develop those skills better. And yeah, so it's just ABA is fun whenever you let it be.
Yeah,
Mhm.
I have to
absolutely.
agree with Dylan. It definitely is fun when you're making it fun. If you're sitting down at a table, it's probably not as fun for the kids. So getting up, doing it outside, under a table, and in the bathroom, I don't know, just wherever you can make it fun and meet them where they need to be. I
I love
definitely agree
that.
with what both of you guys said.
Yeah.
Awesome. So, since we have such a variety of experts on our panel here, can we walk our families through a child? So, we start with the intake coordinator, and then what happens next, and who takes over next, the BCBA, and then we end with the RBT working with them. And when does the BCABA come back, and when does the intake coordinator come back? Would you guys mind walking through that for us? And we'll start with Bridget.
Yeah, sure. So I feel like, every company has their own organizational structure and everyone wears, different hats in the company. So one process from one company might look very different than the other. And I think that's important to identify because parents have different expectations. So let's say that they're transitioning from one ABA company to another. They might say, well, ABC company didn't do that. And, why are you guys doing it this way? So for us, our process, so we have an intake team. We get calls in through maybe it's referrals from other providers. It could be the internet, marketing. And so usually they'll speak with myself or someone from the team and we'll screen them. For me, just because, part of my background and my expertise, I listen really for all of their needs. So our ABA company is a little different. We're a multifaceted company. We provide other services other than just ABA. We have a speech and language provider. We have a micro school. So I listen to other components of the family that they're struggling with. So it could be, maybe they're in a public school, and the child doesn't have an IEP. As I mentioned, we're educational advocates, so maybe we might help them to get an IEP. So I look at everything that they need when they first walk through the door, right? So Then they get sent an intake packet. So they complete the intake packet, comes back to us. We then process it. It then goes to our clinical team for scheduling to see, hey, can we take this client on? So they look at the location, they look at the hours, they look at the funding source, right? That's a big one nowadays, especially with the managed care organizations for Medicaid in the state of Florida. And once the clinical team says, yes, we have availability, we can take them on, then we reach back out to the family and we'll schedule the initial assessment. Might need to get an authorization for that. So we actually have a document that we give to families. So it's kind of like the roadmap. It's called How to Get Started. So it walks them through what every step looks like all the way up to the pairing stages, right? So when they first start receiving treatment. I typically, my intake team, we stay connected with the family all the way up through treatment. And then they're able to reach out to us if they have any other questions about, navigating funding, or they need access to additional resources, or they're looking for transition services, or, like I mentioned, educational advocacy. So that's pretty much on our side operations. And then, they're with the clinical team for scheduling and things of that nature.
Excellent. Thank you. Thank you. And so, and then who wants to take over next?
I can. The process at Virtus seems pretty similar to ABA Path. So we have a intake team as well. A lot of the times we get calls at like our local level, like our centers, and parents just like Googling is usually what they tell me. They're like, hey, like my doctor said I needed ABA for my kid. Like they'll Google like local providers. We'll take down all their information and then give it to our intake team. And then we also have people that inquire through referrals or just on our online inquiry. Similar, like how Bridget had said, they get like an intake form that we have them fill out. And within that intake form, it's like a questionnaire just asking some basic questions about their kiddo, learning who their funding source is, because we want to make sure that we're actually in network and able to provide ABA services, and letting parents know that like early on, like, oh, hey, like your insurance does cover this, or no, unfortunately your insurance doesn't, but here's some resources to be able to get coverage that will allow for ABA. And then once our intake has verified all of their benefits, myself, like all of the lead BCBAs, then do what's called a clinical review call, where we just call and we talk with the parent for a little bit, get like a brief background on the kiddo, figuring out like exactly what those parent needs are, like where the kid has, is struggling the most at, just so we can make sure that they align with like our clinical like availability at the time. Because there's sometimes like some of our clinics in our more like central Florida region, like they break the kiddos up by their age groups because they're closer together. So like they have one clinic that's focused more towards the early learners, and then like one that has the older kiddos, so that way we're keeping same age peers together versus having a mix and match of just random ages throughout. And then once the local team has decided that a kiddo is a good fit, we then submit for that initial assessment. And then we get the kiddos in with their family. We do the initial assessment. And then, the BCBAs, by myself, we get that fun job of then writing the treatment plan and then submitting and getting the kiddo started on like that first session. We also have various handouts that we give our families. And in one of them, like it explains that from the point of intake to like that first day of therapy, it's usually like a 4 to 6 week process, just because of us having to wait on the insurance companies and, getting like all of our plans and stuff together. But in the meantime, we tell our families that they can either reach out to the local team, like once they've met, because we also encourage / kind of require that the families come in for a tour. So that way the parents can actually see where their kid's going to be. And since we do offer services in home, in school, just depending upon insurances, if those are the locations that families are looking at, like we go and do observations there just to make sure, especially for like in school kids, like we want to open that door of collaboration with the school personnel just to make sure that they're comfortable and that it's something that they allow. And then we keep our families updated like through every single step. Like our intake team, they're great about it. Like they try to reach out at least once a week.
Excellent. Can you just talk about the board certified behavioral analyst and the education that you've had to go through to get to where you are?
Yes. So as a BCBA, I had to first get my bachelor's degree. And then I obtained my master's. My master's is in exceptional student education with an emphasis on applied behavioral analysis. And then on top of getting my master's, it has since changed because the board has changed the requirements for BCBAs. I had to get 1,500 hours of fieldwork hours. And in those fieldwork hours, you are learning how to be a BCBA, like from the basics of making materials, which everyone like always thinks is insane, but I'm like, no, there's a process that goes into that, to learning how to write treatment plans, how to engage in caregiver guidance, and how to, just become a more well-rounded BCBA, and like learning things outside of like your scope, like through continuing education courses. So,
Excellent. And then you sit for a certification exam as well, right?
oh, yes, that too. I forgot. Then you get to sit for the big test.
The big test. And once you take the test, it's done, and then you have to do continuing education, or is there repeat testing that has to be done?
No. So once you pass the actual BCBA exam, you do not have to test again if you keep your license active, but every 2 years, we are required to get 32 hours of continuing education courses. And those are broken down into different sections. Like we have ethics, supervision, and then like general. And each section has a minimum requirement. So that way we are upkeeping our knowledge and furthering our careers and learning.
Excellent. So Leah creates the treatment plan, and then you pass the plan off to the RBTs. So who wants to take over next?
I can. On the RBT's end, it's really not that intricate. We really just get our schedule and honestly just start working with the kiddo. Our first session with the kid is mostly pairing. So for me, I will totally take the kids' lead. I will let them do whatever they need to do and just be by their side playing with them. So for example, I think it was maybe a couple-ish months ago, I was pairing with a kid and he just wanted to cook for our session. So that's exactly what we did. Cooking, I think I ate some food and he didn't want me to. So I just stuck to the cooking. But then after that, we get into programs based on what the BCBA creates and take it from there. And then the BCBA will be present through our sessions just to give supervision and give us some feedback if there's something we need to be changing, or if they think something isn't working and they need to modify programs, then they'll let us know that too.
Excellent. And Dylan, do you want to talk about the training and the certification for RBTs?
Yeah. So to be an RBT, you have to do the 40-hour training program. I think I might be wrong about this because it's been a hot minute since I've done it, but I'm pretty sure there's different programs that you can do for the 40-hour training. And so yeah, and then you do a competency that needs to be signed off by BCBA, and then you do the RBT test, which once you pass that test, you're ready to go as an RBT.
Awesome. Awesome. Do you remember your first day as an RBT?
I do. And so usually, well, my first day was wild. So I do remember I was in a company in Alabama, and I think we were short-staffed or something that day, but I was with a kid that I had never worked with before, or not really like seen much of, I guess. And so I just knew, I was like, okay, we're just gonna pair today. And we're not, I'm not gonna run that many programs. I want him to feel comfortable with me. So in the future, when we run programs, he'll be much more likely to respond to me, and we can work better that way. But I just remember pairing with him, and he was very into his iPad, and which, iPads, a lot of people, have controversies about whether kids should have iPads or not. But I was like sitting there watching him watch the iPad and was like, I don't really know how to engage with him. So I just started narrating what he was watching on the iPad. And he just like would occasionally, he'd just be like watching him just look up at me when I was like, I think it was like Lightning McQueen or something. And was just like, oh, Lightning McQueen, like he's so cool or whatever. And he would just look up like, Lightning McQueen, like, was so confused. And then he ended up being my best little buddy. Like, he responded to me anytime I was like giving instructions, or he just knew that like I was interested in what he was interested in. And I think that's kind of when I was like, I really like ABA, like getting close with the kids and, kind of being their friend in a sense. So they learn from you. So yeah, that's kind of when I fell in love with it, was my first day.
I love that. I love
Mhm.
that. So, one of the biggest challenges that families face is really accessing care. What do you feel are the most common barriers families encounter when trying to access ABA services? And whoever wants to take that is welcome to.
I definitely
Okay, I
think
can.
oh, sorry.
You're good, Tori. You can go.
I was just going to say, I definitely think it's knowing what's available and accessible because just like I can't remember who was saying a parent didn't know what ABA was, having them not educate themselves, obviously, but getting educated to know what is out there for them and what is there for their kid, just so they're not out in the dark, not knowing what they can get or what tools are useful for their kid or could benefit them. So, really, just knowing what's out there and doing research to know what's available.
Would you say most families don't know what ABA is when they get to you, or most families do at this point?
I couldn't remember. Are you asking me or
Yeah.
are you asking if I said that?
Yep. Yeah. No, I'm asking you your thoughts on that. Do most families at this point, because everybody's kind of heard of ABA, but do they still really not know until they get to you what you guys do?
I would have to say it might be a mix. Bridget might have a little more input on this since she talks with parents more directly during intake, but I will let her to take the lead on this because
Okay,
it might be a
great.
mix.
Yeah, so I was actually itching for this question. So to answer your question, I would say it depends on the geographic location. So you have areas where there's an underserved population. And so specifically, I used to live in Hillsborough County and I now live in Flagler County, Florida. And this was actually originally, Flagler County was actually originally designed as a retirement community. So, at the time, 20 years ago, there just wasn't a need for pediatric services like ABA, speech, or OT. But now, 20 years later, you're actually seeing that full cycle. Families are here, there's more children, and we need, services now, but the resources haven't caught up. So now you have families who don't even know what services exist, how to access them, or even where to start. And then when they do, there's very limited providers. And even not just in this county, but in the surrounding counties. So, what that looks like in real life is families going without services altogether. Some families don't even leave their homes. I've talked to so many families over here who just like don't even go to the grocery store. We have one school that supports children with special needs. So some of them don't go to school. Some of them are just homeschooled. So they're really trying to manage everything on their own, and it can be overwhelming. So, like I said, usually where you have a community that lack of lack of services, lack of providers, lack of community awareness, and yeah, so it's more popular, like I said, in those areas that just are underserved and less not as accessible to the city. Matter of fact, I had a family that called and they're living in it was like Lee Acres or something. It's somewhere in Central Florida, and they really don't have much around them. And they were going to move to like what was it, Zephyr Hills or something. And I'm probably pronouncing that wrong. I'm terrible when it comes to that. But I was like, oh my gosh. I was like, well, I was like, coming from a parent who looked for services everywhere and would move around just to get the services, I said, that is not a great location unless you don't mind traveling like 45 minutes with a car full of kids that are probably don't want to be in the car, then I would suggest to kind of stay in that Tampa, Brandon, Riverview area. And so I was like, oh gosh, I'm sorry. I feel like a real estate agent now.
Yeah.
She was so grateful after I got off the phone. I was like, don't do this and do this and don't do that. And so there's a lot of different things and components when it comes into accessing ABA and knowing what it is. And you may have a doctor, a diagnostic physician who doesn't provide information. They're just like, here's a script, go do this, so it really comes full circle, right? So from the diagnostic physician to the PCP to really inform the parent, because if you provide that parent with that information on how is this going to help their child, they may be more likely to take action quicker than to just sit on it.
Absolutely. And you're touching on all the points for amazing kids. That's why we're here. So typically what happens is that parents wait all that time for the evaluation. They get the evaluation and whoever's diagnosing has like a bazillion patients waiting. And so you get a piece of paper and say, have at it. And then the family is like paralyzed. And so transitioning from developmental pediatrics to just doing autism evaluations now, really and truly, we have mastered taking care of these families because not only are they getting a diagnosis, they're getting a full call to action, they're getting their therapies ordered, they're getting genetic testing, and they're getting this autism playbook seminar, which is really the golden gem of Amazing Kids, to have experts like you guys come on and really teach them, like, hey, we're ABA.
If I may add one other important factor that I actually went to speak to a nonprofit and they asked this question. And so one of the biggest barriers is that families don't always see that's happening behind the scenes is staffing and credentialing. And so a lot of parents are like, well, you take Sunshine CMS, but like, how come you're on such a long wait list? And so they don't understand why that wait list exists. And so I really, really do involve the parent understanding and educating them on what's happening right now. Like there is a pause in the Sunshine credentialing, for any new providers in our region for Hillsborough County. So that means that, yes, you might have had that provider working over at ABC Company and they might have been credentialed with Sunshine, but when they come over to us, they have to start that process all over again. So really explaining to them that it's not just as simple as switching or getting a new provider. So really educating them on that. So I feel like that is so huge and parents don't know anything about that and not a lot of companies and even Medicaid doesn't explain that to them. So I just wanted to bring that up.
So how long is the wait list for both of your companies, for ABA Path, Bridget, and then Dylan, if you know the wait list for Virtus?
For us, for Sunshine, for Sunshine CMS, we probably are like 60 plus kids on the wait list. But Molina is taking over as of October 1st. So we are in network with Molina. So we have there's light coming soon.
Yeah, great.
I can't fully say exactly what our wait list is. I'm not sure at the moment, but I'm pretty sure it's close with ABA Path, where it depends on the insurance and it also depends, like we have different regions that we serve or different clinics all throughout the west side of Florida. So it just kind of depends on the location as well. But Leah knows a little bit about our Pensacola North, or sorry, our Pensacola region, but I'm not 100% sure about wait lists.
I can say we just recently became re-credentialed with Florida Medicaid within the last year. We are not fully credentialed yet with all subportions of Florida Medicaid. Like right now, I know we're able to take Sunshine and Humana. We are waiting on like our contracts, like Simply and a few of the others, just because Bridget had kind of pointed on that. A lot of parents aren't knowledgeable of that Florida Medicaid has so many different subportions right now. And we have to become, as BCBAs and RBTs, like we have to become individually like credentialed with each individual plan and stuff of that nature. Across the board, our Pensacola region, between our two clinics, we don't have a current wait list, but both of these clinics are almost at max capacity. And I know our other locations as well, because we were able to start taking Sunshine and Humana kids. It has put us very close to wait list for those kiddos because, especially Florida Medicaid in general, they have a lot more guidelines that we have to abide by compared to your private insurance companies. So it causes some issues within our realm and making sure that like we're working through those and staying like as ethical as we can and upkeeping like all of the policies that we need to adhere to.
Excellent. Thank you for answering those questions. So we're getting short on time. This has been such a wonderful panel. Empowering parents with teamwork is really our mission at Amazing Kids, and coordinating care across all the team, all the therapists, school, ABA. I think you guys have this down. Like, you know how to coordinate care, you know how to connect these kids into their communities, you know how to connect these kids into the right school environment. And so I think all of us, diagnosing providers, therapists, school, we just need to continue to work together to help make this process easier for families. But we also know that therapy, again, alone is not the full picture. The goal is for these kids to not need therapy and to not need medical appointments and to get out there and assimilate into society and just be kids. So what does a discharge plan look like for you guys? When do you start talking about discharge? Because I've had lots of families that are in ABA for 40 hours a week for 5, 10, 15 years, and the parents just don't even have any idea about discharge. So what does that look like for you guys, and when do you start talking about that with your families?
I'm sorry, I'll start. I know this kind of sounds insane, but that is something that we actually start talking about in our initial assessments because, like, we want to set that standard that ABA is not meant to be forever. Because, yes, a lot of our kids, do they need lifelong care? Absolutely. Like, could they benefit from lifelong ABA? Probably. But the way that ABA is designed to work, like, we can't do 40 hours for 10 plus years and be effective and still be ethical within our practices. But here at Virtus, we create like a discharge like slash fade out of hours plan when we're drafting our actual treatment plans. And within that, we first start looking at getting those challenging behaviors at a manageable rate. So asking parents like, what are your ultimate end goals for your child? Like, because that's, should be like most important is like, what are these parents like want to see their kids to be? And asking them, like, what's top priority, like behavior wise, like what do we need to like tackle first? Because once we get challenging behaviors at a manageable rate, that's when we can actually see that increase in all of the other skills, like, flourishing. So we talk about discharge and placement all the time in our caregiver trainings. When our kids get closer to like school age, here in the state of Florida, our kids have to start kindergarten the August following their 6th birthday. They can start as soon as the August following their 5th birthday. So like we have that discussion with parents. We're like, hey, like, do you want to send your kid to school this year? Like, here's where they're at. Like, here's our clinical recommendation on whether they would or wouldn't succeed. And then, we look at that. And then also like just that fading of hours of, all right, well, your kids, like there is almost at like age appropriate levels. Like we use the ABLS assessment and, it has the age comparison norms. Like we'll show the parents that and, to help them because my experience, parents don't ever want to give us up, which I get it. I don't ever want to give up the kids either, but explaining to them that like, hey, like your kids, they're thriving. Like, let's see what they can do on their own. But also reminding parents that if major things come up, like the door is always open. Like at some point, some kids do need to cycle back into ABA just because big things happen in their lives.
Yeah. I think that's a beautiful segue into a question. Looks like Savannah's given us a question of how do you encourage the kids to take responsibility for their care and want to implement the skills learned in the clinic into their daily lives?
It depends upon the kid, Savannah. My older kiddos that are considered higher functioning, I am very like direct with them is like what some of my texts tell me. I'm like, hey, like they're a kid first. I don't care that they have autism, but I'm like, hey, like one of my kids one day, like we were going through a phase where he was saying some inappropriate things in the classroom and he didn't understand the social significance of it. And I put it back on him and I was like, how would you feel if your classmates said that about you? And he's like, oh, I would hate it. And I'm like, see, like that's the importance of it. Like that's why you've got to stop and take your accountability and doing that. A big one that I have experienced is we can teach kids like daily living and hygiene skills all day long in the clinical setting, and they are great about it. But then in daily life outside of the clinic, like it falls apart. But like having those tough conversations with like the older kiddos of like why hygiene is important and like why those daily living skills are so key to like living like a happy, healthy life. And, as adults, we have to have tough conversations all the time. And like I tell my techs all the time, like you're going to end up having tough conversations with the kids. So they will implement those skills outside of the clinic.
Excellent. Thank you. And we're 1 minute over. So, what I would just like to end with, what advice do you give a family who is just starting their autism journey? So, if we could just give one piece of advice, I'd like to just run through the panel and start with Bridget. One piece of advice for our families.
Just make sure you educate yourself. And I hate to say it, but not through social media. Go directly to the source, read, watch your videos. And I use this saying all the time. It's kind of like some people like chocolate and some people don't, right? So if you're on social media and some person says, well, hey, this provider is great over here, right? Well, they may like chocolate and you may not, and that may be chocolate. So I just really suggest being your child's best advocate, doing your own research, asking the providers directly, and making sure that you're prepared with all the documentation you need to start services.
Excellent. Great advice, Bridget. Leah, what advice would you like to leave our families?
Pretty similar to what Bridget has to say. When you first get your child's diagnosis, I always like to tell parents, as you said earlier, take that time and grieve because it is heavy hit to the soul. Like, no one wants their kid to be different, but remember that it's going to be a journey, and you are your child's biggest advocate until they can advocate for themselves. And do your research and make sure that you form your opinions on your own and not through others.
Thank you. Tori, you're up.
Leah and Bridget basically covered what I was going to say, but yes, doing research, educating yourself, staying patient, knowing that it may not be an overnight process, but it will happen. And just know that the team you're working with or looking for working with, they're all working towards the same goal. They all want the same thing for you, for your child, for your family. We just want the best, and we want to increase those skills and desirable behaviors.
Excellent. Thank you. And Dylan.
I would just, after you do the research and after, you discover ABA might be right for you and your child, once you start getting in services, ask all the questions. Feel comfortable asking questions and get used to asking questions. Providers, we try to give you all the information up front and be transparent with you throughout the process. And if there's something that you don't understand as a parent, like, it's important that, like, we've been talking about advocating for your kids. If you don't understand something, ask. We want to make sure that you are comfortable, and just as much as we care about our kids being comfortable. Like, it's very much a family effort, and we want you to understand everything that is happening and what we're doing, essentially.
Awesome. Thank you so much, Dylan and Tori and Leah and Bridget. You guys were fabulous today. Thank you for sharing your journeys and your expertise at Amazing Kids. And I can probably pretty safely say at ABA Path and Virtus, we all believe people with autism are truly amazing. Our mission is really to bring clarity sooner to families through evidence-based evaluation and thoughtful diagnostic approaches, and to really elevate these conversations that replace confusion with confidence. So we have another Autism Playbook seminar tomorrow at noon, and we'll have Janetta Bryant with us. And then we have a pretty awesome kiddo named Anthony, who is an avid runner, and he's changing the face of running for people with autism, as he has races all the time. So he's going to be joining us tomorrow at noon. So if anybody today wants to join, please sign up and reserve your free spot. And we also have a couple more seminars coming up within the next month. So to every family that's here listening, you're not behind, you're not failing your child, and you're not alone. We're here to help you, to empower you with teamwork. So thank you all for being a part of our Amazing Kids Autism Playbook seminar today.